Right, so this is a short demonstration of how we need to take the DSD photos and video, or the photo and video protocol, to be able to do digital wax up for our patient or do the full digital treatment plan. The first thing you need is a DSLR camera on a tripod. It has to be on a tripod, it has to be stable. Patient seated on any chair with a black background, which is preferable, so that you do not have any shadows behind the patient. Then you ask your patient to place her hair behind her ears so that you can see both ears clearly. If the patient is veiled or متحجبة, then she has to pull the veil around her right and left ears very well so that you can see equal sides of both. The patient should not look to one side, to the right or to the left. That's why we use the ears, so that we are sure that she is looking straight ahead. She should not look down or up, because if she looks down or up, that makes a difference in our smile curve. The eyes, of course, have to be open during the photo. So when you have adjusted your patient's head position, her head position is quite perfect here, you then ask the patient to separate her lips so that you can see the upper anteriors, so that you can see the amount of exposure at rest. فرقي شوية كمان يا أميرة. Yes. And this is where you take your first photo. Then with the same head position exactly, without the patient moving her head, you ask the patient to smile very hard at the full extension with her eyes open once more, and this is your second photo. So the first is the rest photo, the second is the full smile photo. Then you ask the patient to turn around to take the lateral view. Again, rest where she separates her mouth, and then full smile once more, and this is your fourth photo. Then you ask the patient to turn and look at you once more, readjust your settings for a video. Readjust your settings for a video. It's recommended to start to take your video with the patient on only one side of your camera screen, because you will usually need to take the second video with the mock-up in the patient's mouth on the other side of the screen. So you usually take your first video on the first day on one side, and then when the patient's mock-up is in her mouth, you put the patient's head on the other side, and this is for the purposes of the presentation, so that it's easier to put both videos on the slide. Of course, when we're taking the first video, what we do is we usually don't tell the patient that we're taking this video, and we do not ask the patient to smile. We start to speak up with the patient a little, go into a conversation, say something funny, have the patients laugh naturally, and this is where we use this video as a reference with the photo, so that we can get the perfect smile design for the patient.